One of our amazing viewers at Zamarinj recently asked, would you do a video on the effects of creatine for the elderly? That question is incredibly important and more relevant than ever. Creatine is often misunderstood, especially by those of us over 60. Is it just for bodybuilders? Is it safe? Can it actually help with strength, memory, or energy? Let's unpack the real science and the real benefits of creatine for older adults. Hi, and welcome. If you're over 60 and care about your strength, your independence, and your mind staying sharp, you're in the right place. Today we're diving into creatine, a naturally occurring compound in your body that plays a major role in energy production. But here's the thing. As we age, our natural creatine levels decline, and so do our muscle mass, brain power, and recovery ability. So what happens when older adults supplement with creatine? Stick with me, because by the end of this video, you'll know exactly what creatine does for seniors, how safe it is, and how to use it wisely. And if senior health matters to you, feel free to tap that subscribe button. Before we jump in, let's bust a couple of myths. Myth: creatine is only for athletes or gym goers. Fact: over 50 clinical studies show that older adults benefit from creatine, especially when it comes to strength, cognition, and recovery. And here's a surprising stat. Fewer than 5% of adults over 60 take creatine, yet nearly 70% could see improvements in daily energy, strength, or mobility. Let's find out how. Have you ever tried creatine or considered it? Let me know in the comments. Yes if you have, no if not yet. What is creatine, and why does it matter after 60? Creatine is a substance your body produces naturally and stores in your muscles and brain. It helps produce quick energy, especially for physical activity and mental tasks. As you age, your body produces less. And since most people over 60 eat less red meat or fish, the main food sources, your levels drop even further. Supplementing can help top up those stores, but only if you need it. Creatine and muscle strength. Numerous studies show creatine supplementation improves muscle strength in people over 60. In one clinical trial, seniors who took creatine while doing resistance training gained significantly more muscle and strength than those who didn't. What does this mean for you? Less risk of falls, better mobility, and more independence. Creatine and brain function. Surprisingly, creatine doesn't just help your body, it helps your mind. Studies suggest that creatine may support cognitive function in older adults, especially under stress or sleep deprivation. There's also growing evidence that it may help protect the brain from age-related decline. Is creatine safe for seniors? Yes, for most people. Creatine is one of the most well-researched supplements in the world. For healthy older adults, it's generally safe at doses of 3 to 5 grams per day, but always check with your doctor, especially if you have kidney issues. Most common side effect? Mild bloating or water retention. That's usually temporary. How to use creatine correctly. No need for loading phases or big doses. Just take 3 to 5 grams daily, ideally with food. It's best absorbed with a small amount of carbs. Think half a banana or a little juice. Stick with it daily. The benefits build slowly over 2 to 4 weeks. Creatine myths busted. Myth: creatine is a steroid. False. It's nothing like a steroid. It's a naturally occurring compound your body already uses. Myth: it only works for young people. Wrong again. Seniors benefit just as much, if not more. Myth: it damages your kidneys. Not in healthy people. Long-term studies show it's safe when taken at proper doses. Creatine and bone health. Newer research is exploring the relationship between creatine and bone density. Creatine may help improve the mechanical strength of bone when combined with resistance training, which is vital as we age. As you know, older adults are at greater risk of osteoporosis. While creatine isn't a magic bullet, it might support your bone health by helping you build and maintain the muscle that protects and stimulates bone tissue. Creatine for recovery and fatigue. Older adults often report slower recovery after physical activity or injury. Creatine has shown promise in reducing muscle damage, soreness, and recovery time in clinical settings. If you're walking more, starting gentle workouts, or doing home physical therapy, creatine could support your body's ability to bounce back. Creatine and sarcopenia. Sarcopenia is the age-related loss of muscle mass and function. It's one of the biggest threats to senior independence. Multiple studies now show that creatine supplementation, especially when paired with strength training, can slow or reduce the effects of sarcopenia. This means more strength, better balance, and more confidence doing everyday tasks. Creatine for vegetarians and vegans, over 60. If you follow a plant-based diet, you're likely not getting much creatine from food. For seniors on vegetarian or vegan diets, creatine supplementation can make a noticeable difference in both energy and mental clarity. It's one of the few supplements with consistent, proven results for muscle function and brain energy in older plant-based adults. Creatine and mental health in aging. There is emerging interest in how creatine may affect mood and mental health. Low brain energy metabolism has been linked to depression, and some small studies suggest creatine might have a supportive effect. While it's no substitute for professional help, it may serve as one more tool in your overall wellness plan. Best time of day to take creatine. While creatine timing isn't critical, taking it post-exercise or with a meal may offer a slight absorption advantage. The most important thing? Be consistent daily. If you already take morning meds or supplements, just add your creatine scoop then. Who should not take creatine? While creatine is safe for most, it's not for everyone. Those with kidney disease, unmanaged hypertension, or who take medications affecting renal function should consult their doctor first. Pregnant or nursing individuals and anyone undergoing chemotherapy should also avoid creatine unless cleared by a specialist. Creatine and blood sugar regulation. Emerging evidence suggests creatine may help regulate blood sugar levels when combined with exercise. For seniors at risk of type 2 diabetes or insulin resistance, this could offer a valuable bonus. Creatine and heart health. While not a heart supplement per se, creatine may support heart muscle performance by improving cellular energy production. Some early studies even show improved heart function in patients with heart failure. Creatine and mitochondrial health. Mitochondria are your cell's power plants, and their function declines with age. Creatine supports ATP recycling, crucial for mitochondrial health and energy maintenance. Creatine for inflammation reduction. Some research suggests creatine may reduce markers of inflammation, a major player in aging and chronic disease. This adds to its reputation as a low-risk, high-reward supplement for longevity. Creatine and sleep quality. Preliminary studies suggest that creatine may positively affect sleep cycles, particularly REM sleep, which helps with memory and mood. Better sleep means better energy and function throughout the day. Creatine and joint support. While not directly a joint supplement, creatine can help by improving muscle strength and reducing the mechanical load on joints. This can benefit seniors with mild arthritis or joint discomfort. Creatine and balance training. Balance and coordination decline with age. When creatine supports muscle function and energy output, it can enhance results from balance-focused activities like Tai Chi or stability exercises. Creatine for post-surgery recovery. Recovery after surgery, like hip or knee replacement, is slower for older adults. Creatine supplementation may help retain muscle and improve functional recovery during rehab. Creatine and hydration. Although it draws water into muscle cells, creatine can support better intracellular hydration. For seniors who struggle with dehydration, this could be a hidden benefit. Creatine and immune health. There's ongoing research into creatine's impact on immune cells. While not conclusive yet, it may help support immune resilience, which is especially valuable for older populations. Creatine for women, over 60. Postmenopausal women face accelerated muscle and bone loss. Studies show women benefit equally from creatine, especially when paired with strength training. Creatine and longevity. By supporting muscle mass, bone density, brain function, and energy levels, creatine may indirectly contribute to healthy aging and a longer health span. Creatine and skin. Health creatine's role in cell energy may extend to skin cells. Some cosmetic studies suggest topical and oral creatine might improve skin hydration and reduce signs of aging. Creatine and medication interaction. Awareness creatine is generally safe but can interact with diuretics or nephrotoxic drugs. Seniors on multiple medications should review their regimen with a pharmacist or doctor before starting. Creatine and appetite support. In some older adults, creatine has been linked to improved appetite and nutrient absorption, useful for those experiencing age-related appetite loss. Creatine for muscle endurance. Beyond strength, creatine helps with muscular endurance, helping you go longer in physical tasks like walking, carrying groceries, or climbing stairs. Creatine and energy stability. Some seniors report more stable daily energy with creatine use, fewer dips or crashes, especially when combined with hydration and movement. Creatine in cancer recovery, with caution. While not a treatment, creatine may support muscle preservation in those recovering from cancer treatments, provided it's cleared by a doctor. Creatine and lung health studies in people with respiratory diseases suggest creatine might improve breathing effort and exercise tolerance, potentially helpful for seniors with mild COPD. Creatine and digestive health. Some seniors experience mild constipation or irregularity. While not a laxative, creatine's water-drawing effect and energy support may aid digestion. Creatine as a gateway. Supplement creatine is often a starter supplement that encourages seniors to learn more about their health, track strength progress, or even begin gentle resistance training. Creatine and motivation. Feeling physically stronger often creates a psychological boost. Many older adults report greater motivation to stay active once they feel their efforts pay off. Creatine in everyday activities. Creatine doesn't just help in the gym, it can improve stamina in gardening, walking the dog, standing in line, or lifting bags. Creatine and confidence in aging. When seniors feel stronger, steadier, and more mentally alert, it can boost confidence. That alone can transform how you engage with life after 60. Creatine for couples or friends. Trying creatine together can build accountability and motivation. Sharing results can turn a supplement routine into a fun, health-centered activity. Creatine and balance of other nutrients. Pair creatine with protein, omega-3s, and magnesium for a synergistic effect. It works best as part of a broader nutrition plan. Creatine and personalized wellness plans. Ultimately, creatine should fit your unique needs. Consider your goals: strength, memory, recovery, or energy. Use it as a tool, not a crutch, in your wellness toolkit. Let me share a quick story. John, 68, a retired teacher, wasn't into supplements or gym routines, but after a hip surgery, his physical therapist recommended creatine. Within 6 weeks of using creatine, along with daily walks and light weights, John noticed better energy, faster recovery, and he even went back to gardening, something he hadn't done in months. It's a simple supplement, but it can be life-changing when used the right way. Dr. Darren Kandow, one of the world's leading researchers on creatine and aging, says, creatine is one of the most evidence-based, effective, and safe supplements for supporting strength and brain function in older adults. That's why even small daily doses, 3 to 5 grams, can make a big difference over time. To make things easier, we've created a free one-page printable guide, Creatine After 60, Safe Start Checklist. It covers dosage, timing, tracking changes, safety tips with medications. Check the link in the description to download it free. So here's the bottom line. Creatine isn't just for bodybuilders. For older adults, it can support muscle strength, mobility, brain health, and recovery. It's safe, affordable, and easy to add to your daily routine, as long as you do it wisely. If you found this video helpful, feel free to subscribe and check out our next video, where we explore more simple steps to stay strong, sharp, and healthy after 60. And to @Zamarinj, thanks for the fantastic question. Keep them coming. Stay strong, stay curious, and I'll see you in the next one.